The Femur and Pelvic Girdle by Caitlin Grieving and Wade McGuffey.
Okay, these are the femur anatomy. This is the head of the femur. That is the greater trochanter. That's the lesser one. The linea aspera, the medial epicondyle, the medial condyle, the lateral epicondyle, and the lateral condyle. The head forms the ball and socket joint with the cup-shaped acetabulum. The greater trochanter is the knob-like lateral projection at the proximal end of the femur, where the muscles attach that move thigh outwards at the hip joint. The lesser trochanter, which is right there, is a smaller posterior projecting tuberance at the medial base of the neck, where the muscles attach that move the thighs inwards at the hip joint. And the linea aspera is in the middle, and it's the rough crest of the bone that runs down the posterior surface of the shaft. The medial condyle is down here. It's a bone that sticks out from the femur. It's the inside of the knee. And then the lateral condyle is on the other side, and it's the outside of the knee, and it's smaller and less prominent. The medial epicondyle is larger, and it's the attachment site of the labial collateral ligament, and the lateral epicondyle is on the opposite side, and it's smaller and less prominent to the medial, and it's the attachment of the fibular collateral ligament.
The Pelvic Girdle, which includes the acetabulum, pubic arch, right here, symphysis pubis, which is right here, this disc, the ischium, which is this right here, the pubis, right here, and the ilium, which is this plate right here, and this plate right here. The ilium is the big, flat curvature that provides support. It's the largest of the three bones fused together in the girdle. It is also used in bone grafting due to its large source of the bone. The ischium unites with the ilium and the pubis. It is also it attaches the rotator muscles of the femur that insert on the ischium. The pubis, right here, forms the acetabulum in the hip joint and provides protection to the urinary organs and reproductive organs. The pubic arch, the arch of the conjoined rami and ischial and pubic bones on two sides of the body. The pubic symphysis, which is a thick disc of fibrocartilage right here that allows for some flexibility in the hips. And then the acetabulum, the cup-shaped cavity on the lateral surfaces of the hip bone right here, which receive the head of the femur.
And then this shows the articulation between the femur and pelvis joints, and this is where it goes in, right there.
The location, it's a bony basin formed by two coxal bones that secures the lower limbs to the sacrum of the axial skeleton, which is right here. This right here is the pelvic girdle, which connects to the axial skeleton, and then the femurs right here connect into the pelvic girdle.